a special good evening to each and everyone. Doctors' Day is a special occasion so that collectively we show our gratitude for the doctors, for the service and sacrifice they have done during the pandemic. I salute their sacrifice and services. And the theme of the present Doctors' Day celebration, Doctors' Day is the doctors, family doctors as frontliners. And I'm really very happy and I congratulate each and every medical professional who got the award here. So, looking after the profession and getting the award, it is really a difficult job, particularly in the pandemic period. And I congratulate each and every one who got the award, and it is not easy to be judged by the renowned press like Economic Times. So I'm really very happy to be here. And as I said, the theme of this Doctors' Day this year is the family doctors as frontliners. And we all know the family doctor concept is necessary for the present scenario, particularly in the situations like pandemic. Previous days, during our younger days, always we had a family doctor. The family doctor will be a family doctor and he will be one among the family member. So he knows everything. Nowadays, that concept is vanishing. And I'm very happy that this year the theme is about the family doctor. In a lighter sense, I read in a magazine, one of the very important person called a casualty in a hospital and said that my wife is suffering from appendicitis. So I am bringing her for surgery. Then the doctors in that casualty in the hospital were very much surprised because last month only he brought his wife and he had appendectomy. So when they were all surprised about the call, and the family doctor came rushing, and they told that this man's wife got already appendectomy, and now he is telling that she is having symptoms of appendix. We have not seen a person with 2 appendices. Then the family doctor told, you have not seen a person with 2 appendices, but you have seen a person with 2 wives. So this could be the other person. So that is the concept of family doctor, because he knows everything. So when we go for a secondary care or tertiary care, the doctor is not aware about you, but a family doctor who is aware of all your family matters, who is aware of all your disease pattern, what all the health challenges you're facing. So that is the concept of family doctor, and I'm very happy that theme is assigned this year as family doctors, friend warriors. And I should say, I'm very happy that Economic Times has created a platform to express the views about the challenges, policies which the medical fraternity faces. And according to me, because for want of time, the topic given to me was the need for comprehensive health policy, challenges and objectives in the national health development, a national rural health policy, national urban health policy, and dynamic policies in the health challenges. And first of all, because I don't want to define everything, I don't want to tell about the definition because you're all doctors and you know everything about these policies, but I want to tell about the changes and destinations. Because need for the comprehensive health policy, the Nowadays, because apart from identifying the patients, inpatients, and helping them as policies, now it should be widened, the horizon should be widened, because the mental health should be taken care. Nowadays, we have a habit that we care about physical health, but we are not caring about mental health. So mental health is a subject, a focus which is very important for this period, because the people, particularly in situations like pandemic, the people are depressed, and particularly the youngsters, when they face the challenges, they are depressed and their mental illness is on rise now. So we have to take care of the mental illness, and particularly now the infertility. The extended policies should focus on infertility and occupational health, because we are all doctors. We focus on occupational health of different occupations. But I always feel doctors are bad patients. If I ask a question, how many of you do yoga? When you check the blood pressure of another patient, but how many of you regularly check your blood pressure? You check the blood sugar of patients, but how many of you check your blood sugar regularly? So first, we have to look after ourselves. So in this Doctor's Day, my message is be careful about your health, be cautious about your health, and look after yourself. Be preventive. So that is a message. Because I have seen so many doctors with some of the health ailments, in spite of being an expert, because of the health ailment, they are unable to perform. So my appeal is, please look after your health also. And adolescent age, particularly adolescence, means we are thinking about only menstruation, menstrual hygiene, menstrual health. But we have to look after their psychological health also, their physical health also, their nutrition, and particularly elderly, the menopausal changes and their psychological aspects of everything should be dealt. And the opportunities and challenges in the nation's health development. It is very important. I always laud our Honorable Prime Minister for bringing out the grand insurance scheme, that is the Ayushman Bharat. Because after introduction of the Ayushman Bharat, within 90 days, 6 lakh cardiac surgeries were performed. Within 90 days, that it reveals how the patients were waiting for want of money, so that immediately after introduction of this scheme, 6 lakh people underwent cardiac procedures. Not only that, most of the gynecologists are here. The insurance scheme didn't include the cesarean sections, but this Ayushman Bharat included the cesarean section. So these all things improved the health development of our country. Apart from that, the National Rural Health Policy, I have to say, National Rural Health Policy not only focuses on the health, it focuses on sanitation, nutrition, education, and prevention, and so on. Why I am telling this? Because indirectly these policies have an impact on the health development of our country. For example, when I was studying in Tanjavur Medical College, a rural medical college, a patient gave birth to twins. Both of them was weighing 2 kg, both of them of the same weight. You know, the twins should be reviewed regularly, but when we reviewed the case, the female child was losing her weight. The male child was gaining the weight. We did all the investigations, but everything was within normal limits. Then we asked a question to the mother, are you feeding the babies properly? She told, yeah, I'm feeding the babies properly. How you are feeding? We are feeding when the baby cries, I am feeding the babies. Then suddenly we asked a question, you are almost an undernourished mother. You have given birth to twins. Do you have mother's milk to provide to both the children? Then she told, I am giving mother's milk to my male child, and I am giving diluted cow's milk to my female child. So you can imagine how the social stigma indirectly affecting the health of the children, particularly girl children. So after introduction of good schemes so that the female children are taken care, now the female children are brought up with confidence. And there is a survey which says the female children, even though they are sick, they are not brought to the outpatient compared to the male children. So nowadays, that problem is almost solved because of good schemes supporting the female children and the girl children. And rural health scheme, the vector-borne diseases, a statistic says the number of deaths due to vector-borne diseases are more than the deaths due to war. So where are we? I always, in a lighter sense, used to say, even the man can catch the lion with a net, but he is hiding under net afraid of the mosquitoes. So that is the problem of vector-borne diseases. Because of the National Malarial Program and because of the National Filarial Program, we are able to combat all these diseases. So because of sound health policies, these dreadful diseases can be prevented and abolished. So this national rural policy is very much helpful. And now the new education policy is focusing on nutrition also. Why I laud the new education policy, national education policy? Because it takes care of the education as well as it takes care of the nutrition. And apart from that, the Poshan Abhiyan, because the world statistics says that most of the children in India are undernourished. 60% of women are anemic. So because of these nutritional programs, we are able to face the undernourishment and malnourishment. And now we are facing the challenges with good schemes. And the urban health policy, even though urban health policy focuses on slums and slum dwellers, my appeal is in Telangana, they did a survey. In that survey, they went and opened the tiffin boxes of all the children. Most of the children had chips, burgers, breads. No one had traditional food. No one had traditional food, nutritional food. That was the survey recently done. So the urban policies should focus on working mother also. It is not only the poor people, not only the slum dwellers, the nutritional aspects of because if the children from the slum are suffering from malnourishment, the children from the affluent families are suffering from obesity. So the urban policy should take care of these lifestyle problems also. And I have to say that the dynamic policies in the widened health challenges, I always think that you should have known that the WHO says that for the past 2 decades, the Indian scenario is changing from communicable disease to non-communicable diseases. The lifestyle, because of the lifestyle changes, the people are facing with diabetes, hypertension, and cardiovascular diseases. WHO says India from 2005 to 2015 lost $237 billion because of this transition of communicable to non-communicable diseases. When compared to European countries, the death occurred in the Indians much earlier. Why? Because they were not following it, they were not taking adequate drugs. But after introduction of the generic medicines by our Honorable Prime Minister, Jan Aushadh Kendras, the intake of anti-diabetic, anti-hypertensive medicines increased because of the economy. For example, if the paracetamol is 10 rupees outside, we can get the generic paracetamol for 1 rupee in the Jan Aushadh shops. So because of the availability of these medicines, now the incidence of the non-communicable diseases are coming down. So because of all these supportive policies, we are facing the health challenges. And what is the aim of these generic shops? To create awareness among the people and to make the people to take regular medicines and to create awareness about the generic forms. Actually, one of my friends said, what medicines, apart from the generic medicines, when I go to a hospital, he's giving vancomycin, erythromycin. So what is the mycin he's telling. So because taking a medicine is mycin. So in generic shop, that name is not there. So I am taking the generic shops, even nutritional things. Because 9,000 generic shops are all over the country. And more than 1,600 medicines are enlisted in that. 250 surgical medicines or surgical procedure equipments also available in that. So why I am telling that it is accessible to the downtrodden people. And because of such schemes, we are getting a healthy India, which was from illness to wellness. We are changing. Before we were from wellness to illness, now illness to wellness because of all our supporting policies. And finally, I have to say, I am very proud to stand here because today we have administered 197 crore, 61 lakh, 91,554 doses as on this minute, which is an indigenous vaccine, which I have taken. I am very proud to stand in front of you. We are all very proud. We are all here without our mask because of this vaccination. During our student days, we were expecting the vaccines to be imported. For example, I have to say the rotavirus vaccine, which came to the world in 1998, we could get the vaccine only in 2015. Hepatitis B vaccine, the world could get it in 1982, but we could get only in 2002. Particularly, even tetanus vaccine, it took 22 years. The world got it in 1955, but we got it only in 1978. Compare that situation with the situation of the present situation, where the indigenous vaccine, it was not only a national program, we have exported the vaccine to more than 150 countries. As our Honorable Prime Minister says, unless everyone is safe, no one is safe. Because of the pandemic, because the scenario is changing. Before and all, we used to see the pandemic once in our lifetime. But now, the pandemic, we are going to live with the pandemic. So we have to have extended policies so that we have to face the challenges and the technology, the artificial intelligence and the biotechnology, and the technology is supporting us. Particularly, as I am able to say that now we have crossed 197 crores, 61 lakh, 91,554 doses means because the COVID portal. So we are able to identify because of our technology. So I appeal each and everyone, the awareness should be there. I think that whatever may be the policy, but it should reach the people. As anemia is 60%, when we were students, we used to give anemia tablets to the patients. We think that patients will take it. When we go for lunch hour at the backyard, we see all the anemia tablets, black tablets thrown away. Then we used to pick up and call the people and ask, we gave it for your anemia, why you have thrown it? They used to say, these tablets are black in color. If I take this, my child also will be black in color, so we don't want to take it. So that is the awareness of the people. Even now, people are not ready to take black tablets. Then we used to call them and say, see, I am black only, I am dark only. I have become a doctor, so don't worry. That darkness is a healthy darkness, so you have to take. So creating awareness about the rural public is also very important. In a lighter sense, I can say my experience, I was practicing as a sonologist at Tanjavur Medical College. So one day, one person came, it was the time when the ultrasound was introduced. So when that patient came, I told him, tomorrow I have to examine your prostate. So you have to come with full bladder. Next day he came. Then I asked, have you come with full bladder? He told, yes, I have come with full bladder. Full urine I have come. Then, okay, come. Then he opened a yellow bag and put one Horlicks bottle, 4 Horlicks bottles. I have come with full urine. Now you take the scan. So that is the awareness. Even now, the people, even if I ask for, come for ultrasound, they will say whether it is the Ana Panna Pakara machine in Tamil, they used to say, whether it's a sex determining machine. Because of that only we have banned that. So creating awareness among public, even polio vaccine. Actually, when we propagated the polio vaccine, nobody took it. So with Rajinikanth and with an actress Manorama, the Doordarshan propagated the message of polio vaccine. Then the patients used to come and ask, please give Rajini drops. So after Rajini introduced only, the polio drops also gained the importance. So that type of awareness is needed even now. So as a whole, the health policies, this built on the pillars, 6 pillars. As I said, first awareness, then accessibility. Accessibility means, because even now I am very proudly I can say, as Lieutenant Governor of Puducherry, we had a Puducherry model. Because when there is availability and accessibility only, people will practice. Because when we force them to wear the mask, one of the old men told, you are asking me to wear the mask, where I will get? I will die because I am not getting the mask. So that kindled a thought in me, and then we gave 1 rupee mask in the milk booths. After selling 1 rupee mask in the milk booths, the mask compliance was 95% because of the accessibility and availability. People are able to follow because if it is available and accessible. But that thought we should have. We should introspect what are the policies, what are the advice we give, whether it is reaching the people, whether it is available for them, whether it is accessible for them. So only I laud the central government scheme of giving sanitary pads for rupees 1 rupee, because that improved the menstrual hygiene. So this type of activity should be there. And affordability, because I have told already about the generic medicine shop, after the generic medicine shop, because once I was writing a medicine for one person, then person was telling, you are writing a medicine for hypertension, but seeing the medicine's cost, hypertension is more now. It's now, my BP is shooting now. It is not reducing. You are telling medicine for gastritis. After asking the medicine's cost, my gastritis is more. So that was the condition. But because of the availability of generic and availability of the low-cost medicine, particularly stents, I should say that now it is available 85% less than the previous cost. So because of that, the cardiac surgeries more, stents are more. So even the poor people are saved. And because of that, accountability is more. And because of that awareness, accessibility, availability, affordability, and accountability, there is acceptability of all the schemes. So this is the message we have to say, that whatever may be the scheme, it should reach the people. As Vivekananda said, they are the God. Whatever you do for them, whatever you do for the people, it is the people should be benefited by all the schemes. And when one of the authors said, asked our Honorable Prime Minister, Prime Minister, now you have a pressure of saving 138 crore people in this pandemic. How are you going to manage? And how is your offices working? Honorable Prime Minister answered, since I took office, I wanted to identify the problems in the office. The problem was the files were moving, but lives were not moving. So files moving versus lives moving. So I changed it to life moving than files moving. Now everything is set right. So that type of attitude. So policies, not paper policies, it should be people's policies. Schemes, it is not just schemes, it should be service schemes. So whatever thing which reaches the people, which is beneficial to the people, is the credit of that scheme. And our aim is to make the people healthy and the productivity of their life, and hale and healthy, health for all should be our motto. whatever may be. There should not be any discrepancies, whether they are living in the rural area or urban area, whether they are affluent or economically compromised, or whether they belong to this caste or this religion. The health system should be equal to all. There should be a level playing field. That should be our motto. And apart from that, I salute you all, because this is the Doctor's Day, and I'm very proud because my family is also all are frontline warriors. So with me, I am one among you. So let us all together celebrate the Doctor's Day, and let us pray God that COVID should go away from him, not come away. Thank you so much.